most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapist on the internet.
In our opinion, of course, Bob.
All right, Brad, you got your mic going there?
Check.
All right. Today we're going to talk about how to fix patellar tendonitis. No more pain. It's a self-treatment. This is really effective. We've been using this for years.
Right.
Good old Dr. Syriacs. He's the father of orthopedic medicine. He came up with this. Brilliant man.
Right.
Brilliant.
Long time ago, and the test of time has proven it successful, but you need to follow the steps we're going to go through.
All right. If you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, join us on our website, bobandbrad.com. Go to the giveaway section. We're giving away beauty this week.
Yes.
I'll tell you to you in just a minute. You can also find it on Facebook, Bob and Brad. It'll be pinned to the top of the page, the contest, that is. You can also find us on Twitter and Instagram, 60-second version of us. Also,
Tattoo. No, TikTok. TikTok.
Tattoo.
Let's start.
Anyway, we're giving away a massager from Renpho. Renpho does a really good job, really high quality stuff. We really like their stuff. This is an adjustable head on here. Look at that. You can use it to get underneath in those difficult spots, Brad. You can do it under the arms.
Oh, yeah.
There we go. And it also has like 4 settings, and it's got a whole bunch of different heads. I think like 6 of them, I believe.
6 is right.
And it's got a good percussion.
Right.
So,
and you're going to see, actually, it's very versatile. We're going to use it on our diagnosis today.
oh, yeah, that's right.
But
Okay.
put that away for now, Bob.
All right,
We
there
got
we
work
go.
to do. All right. So, patellar tendonitis, infrapatellar tendonitis, refers to the tendon below the kneecap or the patella. And let's show on Sam first.
Sure.
Give
Let's
a little
start with that way.
anatomy lesson. I have my official pointer here.
Yeah.
There we go. Okay, so here we have, now keep in mind the patella or the kneecap is part of a tendon that connects all 4 quadriceps. All 4 of them connect to the patella, which then connects to the infrapatellar, the patella or the tendon
below the kneecap.
Right. So it's a short tendon, and it takes a lot of stress.
Yes, it does.
Particularly if you're doing squats, if you're doing repetitive motion like running, particularly up and down hills or steps.
They call it jumper's knee because a lot of high jumpers or people that do repetitive jumping like basketball or something, they quite often get it.
And actually the location of where the tendon has the irritation or the rupture, if you want to call it that, is, we'll get the tendon out of the way, is where it connects to the bone. You don't have a piece of elastic in your body like this, by the way.
You got a bony tuberosity. Now the thing is, when he said a rupture, generally it's kind of like a minor tears.
Right. That was an overstatement.
Yeah. If you have a rupture, you probably won't be able to use the knee.
Right.
The other thing you want to be a little careful about is Osgood slaughter. That's a disease, I'm sure named after Osgood and slaughter, probably. That actually can cause pain in the same area, especially over the bump. And you're going to want to make sure that's ruled out because that's a whole different animal.
Right. And oftentimes the tibia, the bone, is kind of a big bump there, and it can turn into
it gets
one.
Inflamed, or it gets a little bony overgrowth there.
Right. So this is not a rash or a big zit on my leg. I sacrificed my skin, colored it red. That is the location of my infrapatellar tendon. And the black marks represent where the tendons connect to the bone.
Sure.
And typically that above or below is where that irritation starts. And if you really palpate or poke on it, the tender spot is usually there. If it's really bad, the whole thing starts to hurt, and you cannot get that detailed. So we talked about the repetitive motion, squatting, high intensity, high repetition can cause the irritation. And once it gets inflamed, it can be really tender.
Yeah.
And when it's at that point, the first point of treatment is going to be, and I like this the best, you want to use some cryotherapy, cold packs, but actually the ice massage with an ice cup, I like the best, particularly on this because it's a superficial injury and it really cools down the injured site quickly. So you take a cup of water, put it in the freezer, take it out, and tear away the sides of it. This is a styrofoam cup. That was
styrofoam or a paper cup.
Yep. Expose the ice, rub it down a little bit. I don't know where my towel went, but Don't
get
worry
you on-
about it. And then you just ice over it for 5 minutes, and that's going to adequately cool down the area. It's going to decrease the inflammation. The pain is going to drop down. Oh, thank you, Bob. And it's a good way to treat it. Now, when it's an acute phase or when it's first injured and real tender, you may
there we
fall
go.
right out. But don't worry, it won't make a big mess because it's ice. You'll do that. You could do 5 minutes every hour. That's kind of the extreme. Most people do it a few times a day.
Right.
It's
And
more typical.
The other ththing that Brad should mention is that you want to decrease your activity level.
Oh, that's right.
Yeah, I mean, the first thing you want to do is, I'm afraid to say this because it's very difficult, and coming from Brad, it's very difficult because he won't take care of his pectoralis injury. But
That's another story. But
yeah,
yeah,
but you want to you got to calm it down, and to calm it down, you need to decrease your activity level. So if you're playing basketball, it's causing it, you're going to have to decrease
right.
playing basketball for a while until it calms down and
Right.
stays calm
If you're
down.
squatting and it irritates
Yeah.
it to squat, you're going to have to. You should just stop for a few
You can't
days.
work through it.
Right.
It's just going to
Yeah.
keep getting worse and worse, and it could even be tear some tissues more.
I can attest to that because I'm the kind of person that'll do that.
Yeah.
Anyway, so let's carry on. So you're gonna cold pack, ice massage, cut down the intensity or stop the activity that's
Right.
irritating it, and then you're gonna go to the cross friction massage, which Bob referred to before by Dr. Syriax.
Yeah. To me, this is the big crux of the treatment here.
Yeah.
This thing can really make a difference. I've done, in the past, before I used to use that, I'd do all these other things, and it seemed like nothing was really helping. And I started the cross fiber, and it seemed like within a couple days,
Yeah,
got great improvement.
Work better than phonophoresis, all these fancy things that we do in the therapy
Right.
department, and they cost a lot more. But this you can do at home. The fibers of the tendon go this direction. We're doing a cross friction, so we're going to take the massage and go across the fibers, and you can just use typically not one finger but two fingers because you're going to get in fairly deep onto this tendon, and then you're going to go back and forth.
And you can do one finger on top of another,
Yep.
or if
Or
you want to give a little
three
more higher pressure.
fingers. Yep. However you do it.
You really want to get into the tissues, though.
Yeah.
You don't want to be superficial on this one. You're going to really dig in.
Now, what you're going to do is after about 30 seconds, if it starts, it may hurt when you first start, but after 30 seconds, it's like hurting more and more. It's too early. You got to go back to the cold pack, leave it settle down for a day or two. But typically, you're doing the right thing is after about 20 to 30 seconds, the pain levels off or gets better or kind of gives a numbish feeling.
Then you're golden.
Then you're gold. Then you're going to keep doing it until your fingers get tired
You're
and
rubbing
sore.
the red right off.
I know. See, it's getting better.
Now,
I
normally
feel
what's
better.
happening on I guess on a micro level, you got the
Scar
scar
tissue.
tissue, and it heals in an erratic fashion, almost like a spider web.
Sure.
And supposedly, by doing the cross fiber massage, you're realigning those fibers. They're stronger, so they won't break open again. What happens typically is that it starts to heal. It heals in an erratic fashion. You go and do something, it breaks apart again.
Start all over.
Yeah. So if you massage it, it's supposed to heal, one, quicker because you're getting more blood flow to the
There
area,
you go.
but two, it heals stronger.
Right.
And so it's less likely to break open again. And so you don't fall into that pattern of like, crap, I keep going, every time I go back to my activity, it starts hurting again.
Yep. Back
So-
and one step forward, two back. Now your fingers, I mentioned, get sore.
Yeah.
Because Syriax says you can go up to 15 to 20 minutes of cross friction, but your fingers will never last that
Right.
long. So that's when, if you buy a massager, and we've got two of them here. Here it is. Two options that we like. We like the Renpho because they work well and they got a great price on them, and they're built well. It's a win-win
Yeah,
situation.
this is a less expensive model, the Renpho. So we'll have links down
Yeah.
for both of them. This one's a lot more expensive, but this is like high quality. This is like,
Well, I think they're both high quality.
they're both high quality, but this is like
More
DeWalt,
aggressive.
and you can, it's more percussion on it.
Yeah.
And it can, I just think it's going to tolerate heavier forces, Brad, in my opinion.
Well, I'm saying this. I like this one if I'm on a smaller muscle. If I'm on
Sure.
a bigger muscle, I definitely want this
Sure,
one.
gotcha.
But I think they're both good quality. And
I
then
concur. Yeah.
So I'll show you now with something like this that has a lot of percussion. If I go on this and it's percussing this way and I go straight on, it's not going to be good. We need to adjust it. Plus, it's percussing this way. We want that
Cross
cross
fiber.
motion. So we're going to go at an angle this way. And this is working good. And I can adjust the intensity by how much pressure I push down, as well as if I angle up a little bit. Again, I'm not going to go like this. I'm going to go like this and work that cross friction massage. Now, my fingers can put up with this for
Right.
that 10 minutes.
And that's
or
the
whatever.
thing. Like you can watch TV or, you know, binge on Netflix or what do you want to do.
You can watch Bob and Brad on Netflix
That's
while
right.
you're fixing your knee.
Right. And the thing is, you're just not going to tire you out. You know,
Right.
when you do it this way, you do it for a minute or two and you're like, okay, I've had enough. You know, so
And, you know, we have been promoting these for about a year now. So if you already have one of these, don't fret. You can use it and it will work. But it's just not quite as aggressive. It doesn't have the displacement. It's quite a bit cheaper than the other one, too, I
yes,
think.
it is.
So,
Quite a
yeah,
bit.
they're both options.
Yeah.
All right, Bob, what say you?
Well, we did talk about going back to activity, Brad.
Well, we kind of did already. So once it's feeling better, the thing you do not want to do if you're a jumper, or say playing basketball, you're not going to go in and play
hit
a
it
game.
full force.
Right.
Away.
You want to go in and progressively work. If you're a runner, you know, start out, if you've been running 10 miles a day, you may go back to 1 or 2 miles a day at a slow pace.
Maybe run, walk.
Right.
Maybe, and, you know, and Brad mentioned before in other videos that you want to increase on a 10% ratio.
Yeah.
So like if you've been doing a mile, the next day you do a mile and a tenth.
Right. If
So-
you're doing 10 miles, which you wouldn't, but I mean, you know, 10%. And that's on a weekly. That is hard to discipline yourself, particularly if you're a competitive person, you try and get back to an event. If you're like us, where we just do stuff
This
for the
is a
fun
big
of
part
it.
of recovery is allowing the body to heal.
Yep.
Otherwise it'll just break open and you'll be starting all over again.
Yeah.
So,
The younger people can get away with it. People like us,
yeah.
you got to be a little slower.
Thanks for watching, folks.
Be careful.